So what is periodontal disease? Periodontal disease is also known as gum disease, gingivitis, periodontitis. Some people even refer to it as pyorrhea. But it encompasses gum inflammation all the way to bone loss around the teeth. Here's how the process works. Your gums form pockets around all your teeth. And us dentists want those pockets to be shallow because every time you eat, food and plaque gets pushed up into those gum pockets. And if they're shallow, that means you can clean out all the food and plaque just through regular brushing and flossing. Problems arise, however, when the pockets get deeper. As the gum pockets get deeper, plaque is left behind beneath your gum line. This plaque calcifies and turns into tartar or calculus. And then the tartar and calculus in turn elicit a really low-grade infection which leads to bone loss around the teeth. Now this low-grade infection doesn't hurt, and because it's so gradual, it just kind of sneaks up on you. Kind of like how people can have high blood pressure or diabetes and not know they have it until it gets to the advanced stages. If caught early enough, periodontal disease can be reversible. If you have gingivitis, that can usually just be reversed through more adequate oral hygiene. But if you're starting to develop a little bit more advanced stages of periodontal disease, what we can often do is a procedure called deep scaling or scaling and root planing. This is a more thorough cleaning than just a regular hygiene cleaning. What we end up doing is getting the tissue numb, and then the area beneath your gum line is much more aggressively cleaned. In fact, the tartar buildup beneath your gum line is literally scraped off your roots. But what this will do is, as the buildup beneath your gum line is removed, it allows the gums to shrink and tighten because the inflammation is going away, and consequently the gum pockets will shrink down too, which gets it back to the healthy range. So in that situation it is reversible. On the other hand, if you have bone loss around the teeth, the deep scaling won't reverse the bone loss. And in those cases, additional treatment is needed. This is what is often referred to as gum surgery or periodontal surgery. And in certain cases, if the bone loss is severe enough, bone graft material is even placed to help regenerate the missing bone. So what's involved with the procedure of gum surgery? It's similar to having a filling done, in the sense that this is done under local anesthesia. So for instance, you would just come to my office, we would get the area to be worked on and anesthetized, and then you wouldn't feel this, but I would just make a little incision along your gum line, reflect back your gum tissue, and I would adequately cleanse any residual tartar buildup deep down and any infected gum tissue. What I'm able to observe at that point is the actual architecture of the jawbone around the teeth. And from there I can determine whether or not you would benefit from having a bone graft or not. The conditions have to be just right to add bone because, as you can imagine, with saliva and bacteria always floating around your mouth, grafting bone and regenerating bone can be pretty challenging. But from there what we'll do is either add bone graft or we'll recontour the bone around the teeth very slightly. And what that does is, when we suture back the tissue, it allows the tissue to heal and it surgically shrinks down the gum pocket to the healthy range. It will be sore for the day we do the procedure, and I won't want you to work or do any extensive activities. We'll go over some special home instructions like what to eat, how to brush, and we'll go over the prescriptions that we give you, such as any prescription medicine for pain, for infection, and we'll even give you a special antibacterial rinse we want you to use. Most people can end up going to work and resume their daily activities the following day, but it will be tender for several days. And we will be doing some follow-up checkup visits to make sure everything's healing okay. When it comes to the bone graft material, the bone graft is medical grade sterilized bone, so there's no chance for any sort of disease transmission. Your body accepts the bone graft material and actually uses it as a scaffold for which to build its own new natural bone. Over a period of a year or two, the bone graft material will tend to dissolve away, at which time the new natural bone will have taken its place. But the main thing to keep in mind when it comes to periodontal disease is prevention is the key. By flossing daily and getting regular cleanings and checkups at your general dentist's office, hopefully you'll never get to the point where advanced treatment needs to be done.